Hello, everyone. I'm Jack Collins, and welcome to another episode of Ethics Bites. Today's episode will focus on patient autonomy and evidence-based practice. I would like to begin by introducing you to Hafiz, a community pharmacist, and Neha, a patient who comes into the community pharmacy requesting advice on the use of some prescription antibiotics for a urinary tract infection.
Hello, can you help me? Please, I'd like some advice. I have a bladder infection and I have a box of antibiotics at home called ciprofloxacin 250. I'd like some advice how to take it.
To make sure I provide you the right advice, I would like to ask a few questions. Was the antibiotic prescribed for you?
Oh, the antibiotics are for my father-in-law, but he didn't need to take them, so we just kept them at home.
What are your symptoms?
It's uncomfortable and it burns when I go to the toilet. I've had this a couple of times before in the past year or so, and I take antibiotics for a couple of days and it goes away. I saw a doctor a few years ago and she told me it was a UTI.
Okay, I can understand that must be uncomfortable for you. Have you seen a doctor on this occasion?
But it's really uncomfortable. I have a long car journey tomorrow and I'd like to feel a little better before that. And I haven't seen a doctor this time. I said, no, it's the same thing. And I really don't have the time to see the doctor before I leave tomorrow.
Let's pause for a moment here and take a closer look at the situation that's unfolding with Hafiz and Neha. First, let's take a look at the facts of the issue at hand. A female patient, apparently with symptoms of a UTI, is requesting advice regarding the use of a non-prescription medicine without a valid prescription. She is seeking advice on some leftover tablets from her father-in-law. We do not know if this is with his consent or not. She does not want to go to the doctor. She's planning on taking a long car journey the following day. Taking a look at some of the ethical parameters in this situation, the first that we need to consider is the principle of respect for patient autonomy. If we consider this, you are allowing a patient to make their own decisions regarding their healthcare. In this situation, this would be the woman's desire to not see a doctor and to use the antibiotics that she has. The second principle we need to consider is that of beneficence. If you do happen to provide appropriate dosage advice, you are potentially helping the patient alleviate her symptoms due to the infection and giving her advice on how to take the medication safely. Next is the principle of non-maleficence. Even if you do happen to provide appropriate dosage advice, you may be contributing to antibiotic overuse and subsequent antibiotic resistance. You have a duty of care to the wider community which may be breached by giving this advice. Furthermore, there is a greater risk of unnecessary adverse effects from the use of ciprofloxacin compared to a narrower spectrum and guideline-compliant treatment. Additionally, it is important to consider whether the medication is still suitable for use. Has it passed its expiry date, and has it been stored appropriately since it was dispensed? We do not know how long she has had the antibiotics at home. After considering the ethical parameters of the issue, we need to take a look at the legal parameters. This prescription antibiotic was not prescribed for the woman who is presented to the pharmacy. Prescription medicines are legally only to be used for the person for whom they are prescribed. Although ciprofloxacin may be available without a prescription in some jurisdictions, it is important to consider if the ciprofloxacin is the most appropriate antibiotic in this situation and whether medical review is warranted. If the patient experiences any adverse effects from using the medication or further complications from the infection, the pharmacist may be held accountable for any advice they give. Moving on to values. The first value we can consider here is empathy. It is important for the pharmacist to be mindful of the patient's situation. She has expressed that she is experiencing discomfort and that it may not be possible, or necessarily her preference, for her to see a doctor in a timely manner. Next, we need to think about trust. Trust in this situation presents as both trust between the pharmacist and the patient in front of them, as well as between the pharmacist and the wider community they serve. Patients and the wider community expect pharmacists to practice within a legal framework and provide evidence-based advice and care that optimizes outcomes. Professionalism. The pharmacist is accountable to a professional code of conduct and the wider regard of the profession in the eyes of the community. Pharmacists should practice in a manner that does not risk bringing the profession into disrepute. Taking all of these things into consideration, let's have a look at the options we have here for Hafiz as the pharmacist. Option number 1 could provide the ciprofloxacin dosage advice. The implication of this is that it may maintain trust with the patient, and we certainly are respecting the patient's right to autonomy. Beneficence may have been provided by providing a treatment to the suspected infection. This is, however, not 100% legal and should not necessarily be encouraged. We cannot forget that there is a possibility of liability to the pharmacist if anything goes wrong. Option 2 is to refuse to provide the ciprofloxacin dosage advice. The implication of this is that the pharmacist has adhered to their professional obligation to practice legally and in an evidence-based manner. This has possibly minimized potentially inappropriate use of antibiotics, therefore resulting in non-maleficence. However, the loss of trust is possible if anything goes wrong, and also a loss of trust between the community and the profession. Option 3 is to offer an alternative that is legally permissible and appropriate for this patient. If she is not convinced to go see the doctor, there may be an alternative that could help alleviate symptoms until she can seek a doctor's consult. For example, non-antibiotic symptomatic management, including urinary alkalizers or simple analgesia. In addition to standard non-pharmacological advice such as adequate water intake. The implication of this option is that this is a balance of the previous two options and demonstrates respect for patient autonomy, practicing within legal boundaries, possible beneficence from the advice of symptomatic treatment, and non-maleficence, as well as maintaining trust and upholding the reputation of the profession. Let's see which option Hafiz chooses to take.
It's really uncomfortable. I have a long car journey tomorrow and I'd like to feel a little better before that. And I haven't seen a doctor this time. I said, no, it's the same thing. And I really don't have the time to see the doctor before I leave tomorrow.
I understand your situation and that it is difficult for you to see a doctor. However, based on what you've told me about your symptoms and your previous infection, I think it's important that you are assessed by a doctor before you start any medication.
Okay, I see. I'd really rather just take the antibiotics I already have, though. Won't they work this time?
I cannot give you specific advice for the circumstances as it has been prescribed for someone else and you have not seen a doctor. It is possible that the ciprofloxacin may not be the most appropriate antibiotic, as different antibiotics are best suited for different bacteria, and it may also cause some unwanted side effects.
Okay.
If you would like, I can offer you something to temporarily manage your symptoms and try to arrange an appointment for you for a doctor nearby that may be able to see you shortly so that you are able to be assessed as soon as possible and commence appropriate treatment before heading off tomorrow. How does that sound?
Oh, that will be very helpful. Thank you.
Great.
In this situation, the pharmacist provided all of the key information to the patient, including, most importantly, the rationale and justification for the decision they ended up making. This demonstrates respect for the patient's autonomy, which in this case has been somewhat compromised by declining to provide the dosage advice as requested and instead referring the patient to see the doctor as soon as possible. This scenario highlights that there are ethical principles that can work both in favour and against providing the advice, and that ethical decision-making is not necessarily always straightforward and black and white. A person must apply their own values, knowledge of ethics, and professional code of conduct in order to strike a balance when making a decision in these situations. If handled carefully, a situation like this can turn out to be a win-win situation for both the pharmacist and the patient without a compromise of professionalism. Has something like this ever happened to you? And how did you respond? What would you do in this scenario? Let us know in the comments.